Now, there's a concern growing at that over the high number of COVID-19 home deaths in KwaZulu-Natal. The province has recorded over 200 cases of COVID-19 infected people who have died at home. But for more on this, Premier Sihle Zikalala joins us now all the way from Durban. Premier, a pleasure to talk to you and good morning to you. This is concerning, surely. I mean, when you divulged those stats this past Sunday, it is a growing concern for the province, I understand, in terms of the amount of at-home deaths related to COVID-19.
Yes, this is quite devastating because it means that if you will have 200 people who are reported, there is a possibility that others are not tested. They just died at home and then taken to mortuaries, and then they get processed until they get buried without being tested. And that's why we've insisted that families should always report and ensure that they request for testing so that the human remains of those who would have died at home get tested before they get buried.
I mean, you're also saying this, Premier, I understand, if I may just jump in there, because you're saying it's important to document these deaths and the causes of these deaths, because it would allow you an opportunity as government to have a better strategy on how to approach this surge of COVID-19 within the province.
Indeed, because if someone dies at home and then he gets tested and you find that he or she was positive, it might mean that you would have infected other people, and therefore it would be important to ensure that we move with speed to trying to test the whole family and relatives who would have been close to him or her, and ensure that they get support at an early stage. Coupled with the home deaths are people who arrive in hospitals late while they have degenerated because of disease. And it is important that all of these things are treated at once, and we have a comprehensive strategy to intervene.
Right. Premier, while we're talking about the surge of, COVID numbers, I mean, the province also seeing that number in hospital admissions. Take us through some of the stats you're seeing here. And as you answer, I just wonder as well that could it be a possibility that some of these deaths we're seeing at home, some of those that are COVID-related, maybe due to people not wanting to go to hospital? Because there has been that fear that perhaps if they go to hospital, they may not come out alive, they may not survive, or something may happen, they may stay long. What would you attribute this in terms of those admissions at hospitals and some of those deaths at home?
Indeed, there are fake news and some misinformation that is peddled around the issue of COVID. Firstly, some are saying if you go to hospital, there is less possibility for you to return safe. And that's one issue we need to clarify. Many people, in fact, if you look on the stats, it will indicate that recoveries are more than those who are dying in hospitals. So it is important, even up to now, the death rate is around 3%. But more than that, this misinformation does not only end at a level of hospitals, but even some are still continuing to say even vaccinating is not good for people's health. All of that is misinformation that we need to confront and educate people on why it is important that they report to health facilities early when they feel that they've got fluish or they have contracted the virus. But secondly, it is important that all of us continue to educate people to vaccinate, because vaccinate has been proven to be assisting in ensuring that a person is able to withstand the impact of COVID-19.
All right, Premier, as you continue, of course, to find ways to deal with COVID-19 in the province and further educate, residents of KwaZulu-Natal, we, of course, appreciate your time this morning. Premier Sihle Zikalala. Thank you.